Complications of root canal treatment. Root canal has high success rate, but there are a number of complications that can arise during any routine root canal procedure, of which you should be aware. Fortunately, they are not common and do not necessarily need the tooth to be removed. They include missed root canals. If the tooth has more canal than anticipated, or if it's in abnormal position, the bacteria remain in the affected canal and can recontaminate the tooth. The root may have a large lateral and accessory canals that are difficult to sterilize. Fractured root or crown. Root-treated teeth and those without blood supply are more brittle or more prone to fracture. The location and extent of fracture will determine if the tooth can be saved, but more often, an extraction will be required. Reinfection. This may be due to insufficient and inadequate cleaning, complex root formation, or connection to the outside of the tooth via fracture or lateral canal. Fractured instruments. This is probably the most common complication that occurs. This can happen when the canals are very curved, or when the rotary files have been used too many times without being changed, or with a too much speed jerk. If it is a large piece of file, it can sometimes be removed immediately. If this occurs after cleaning has been completed and is only a tiny piece right at the tip, the tooth can often be filled up to this point. If it's occurred before through cleaning, then it needs to be removed. Perforation. Sometimes instruments may accidentally perforate the root during filling. Often this particular risk when the root of the tooth is very curved or it has sudden twist. Management depends on the size and the location of the perforation. Scelrosed and calcified canals. If a canal becomes scelrosed, it presents a challenge performing a root canal. Phoenix abscess is a dental abscess that occurs immediately following a root canal treatment. Risk of occurrence of phoenix abscess is minimized by correct identification and instrumentation of the entire root canal. Treatment involves repeating the endodontic treatment with improving debridement or tooth extraction. Antibiotics might be indicated. Immature teeth with the incompleted root. If a child receives a knock to a front tooth sufficient to kill off the nerve before the root has finished growing, we are left with the open apex, a very wide canal that is difficult to treat. A root filling cannot be placed in the normal way. A barrier to back a filling against is needed and can only be achieved by repeatedly readdressing the tooth every 6 weeks until this occurs. Perio endo lesions. If the tooth has associated periodontal problems, this provides a continued source of bacteria, and the infection and the prognosis become questionable. Other very rare complications include altered sensitivity following treatment, allergic reaction to the medicines or materials used, perforation of the maxillary sinus. Thank you for watching.